Hi guys, my name is Hannah. I am a licensed professional counselor and the lead clinician at Recovered and Restored Eating Disorder Therapy Center. Today I'm going to be talking about ARFID, which is an acronym for Avoidant Restrictive Food Intake Disorder. ARFID is categorized by intense restriction. People with ARFID do not experience distress about their food, their appearance, or their body shape, but rather their restriction is focuses on textures or smells, colors, shapes of food, to name a few. So there are a few different types of ARFID. I'll just run through them now. The first one is avoidant. It is probably the most common type of ARFID. In this condition, people avoid certain foods in relation to the sensory features of the food, which cause sensitivity or overstimulation. These patients, or these clients rather, might feel sensitive to smells, textures, like softness, general appearance, color, that type of thing. Another type of ARFID is aversion, which is for individuals who have a fear-based reaction to certain foods. So for example, if someone avoids food because they're afraid of throwing up or choking or having to swallow, that would fall under the aversion category. The next type is restrictive. So people with restrictive ARFID typically just don't have interest in food. They might forget to eat altogether or just not be interested, have low appetite, get distracted during mealtime. They also typically just have a low variety of the foods that they will be interested in eating. So those are the three types of ARFID. One thing that is important to note about ARFID is that people with ARFID are typically unfairly labeled as picky eaters. So I understand this might come from a place of just not knowing that ARFID is actually a serious mental illness. It is not true. People with ARFID are not just being picky or being stubborn or being annoying or trying to get back at their parents or whatever the case may be. It actually is a mental disorder that deserves to be treated with compassion. Unfortunately, there is a limited number of research and studies being done on ARFID at this time, so it is challenging on all fronts, and I have so much compassion for people who are both facing it, recovering from it, and have recovered from ARFID. ARFID also can co-occur with other mental diagnoses like anxiety, depression, and autism. Like I was saying before, symptoms of ARFID can look similar to symptoms of anorexia. The biggest differentiator is that people with ARFID do not experience distress around their body size. Some symptoms that occur in ARFID that are similar to anorexia, though, might look like severe weight loss, a loss of a period, challenges with keeping appropriate vitals, low iron, low thyroid levels. People with ARFID also might have difficulty eating in front of others, which I'm sure you can imagine it would be hard to eat in front of someone if they're calling you a picky eater. So seeking treatment for ARFID can be very challenging, and I think you're very brave, not only for taking the first steps to find help, but even just for looking at this video and showing some interest in a topic that's not super widely researched. Like other eating disorders, best practice with treating ARFID is having a pretty well-educated treatment team that looks like a therapist, dietitian, psychiatrist, primary care provider, and in some cases, a speech language pathologist. So I will just run through what each of those roles on this treatment team would look like. So for one, a dietitian would come up with a meal plan to be sure that the client is meeting all of their nutritional needs. Like I said, people with ARFID sometimes have limited variety in foods that they're able to eat comfortably. So it's just helpful that a dietitian can be monitoring that and being sure that like necessary vitamins and nutrients are being met. A therapist will help a client manage the emotional distress that can come with trying exposures. So I'm sure you can understand doing something hard takes an emotional toll regardless of what that hard thing looks like. And with ARFID, doing exposures over and over again can be extremely emotionally taxing. So it is helpful for clients to work closely with a therapist so that they can learn how to effectively manage these emotions. A primary care provider will work with the client to be sure their vitals are stable. A psychiatrist can help manage medication, so helping to be sure that medication or anxiety is being treated with meds if that is appropriate. And lastly, a speech language pathologist can be helpful for working with clients who have aversion ARFID, so clients who are afraid of swallowing or choking, just so that they can relearn doing those things again. While I can understand having a treatment team of all of these providers is very costly, even one or two is super helpful. And I also think the more support and the more knowledge, the better, if you can swing it, of course. So like I was saying, a therapist's role in treating ARFID is to help client manage their emotional challenges as they go through exposures and provide support to the client as they continue to try to challenge themselves on a regular basis. So in my work with clients with ARFID, we use an approach of exposure therapy and dialectical behavioral therapy, or DBT. So in exposure therapy, my client and I will create a hierarchy of foods that they might not feel comfortable with, rank them from the lowest amount of the easiest to try to the hardest to try, and also label each food with the amount of anxiety that is elicited when we think of trying it. So we'll work together to create the hierarchy, and then together we will work on starting from the bottom and working towards the top when it comes to trying things on the list. So as we work up the hierarchy, we will troubleshoot and see where we can provide interventions for distress tolerance, emotional regulation, and all the things that come with trying hard things. So one of the ways that I do that is by teaching clients half smile, which is a DBT skill that simply involves turning the corners of your mouth upwards. So faking a smile, really interestingly enough, sends neurotransmitters to your brain that you are happy, and doing so will regulate your nervous system and return to baseline. So regardless of what you're feeling, whether it's frustration, anger, sadness, distress, if we take a second to pause and just lift the corners of your mouth upwards slightly, that sends signals to your brain that things are good. We got this, we're cool. And soon enough, you will return to a baseline emotion. And this can be practiced when experiencing any type of stressful situation, but specifically with ARFID, while trying something challenging, practicing half smile can help a client just return to baseline while trying this challenging food. Another skill that I really love, if you've ever worked with me before, we've probably talked about TIP, which stands for temperature, intense exercise, paced breathing, and progressive muscle relaxation. It's another distress tolerance skill that I love. I specifically lean into the temperature and the paced breathing aspects. So in this example, if you are trying something really hard and having an intense emotional reaction, I might encourage you to grab an ice cube or an ice pack and hold it to your neck, your forehead, to your wrists, and just allow yourself to feel that cold ice pack, which allows your nervous system to return to baseline. And while doing the ice pack, we might also practice paced breathing together, like 4x4 breathing, or any breathing skill that you've learned before that's helpful for you. And this also just helps clients return to baseline. One of the hardest things about ARFID is that it takes a lot of practice. So it's not going to be perfect the first time, maybe not the second time, and maybe even not the third time, and that's okay. But we have to continue showing up. I will be there for you. Your clinician will be there for you. And you are very brave for continuing to show up for yourself. With that being said, living with ARFID is very hard. And I'm proud of you for showing up. And I think above all else, one of the best ways to recover is to find support outside of your support team even. So that can look like friends or family, or surrounding yourself with loved ones who are cheering for you through thick and thin. I know it can be very hard to expose yourself over and over again to hard things. So try to limit the judgment that you're placing on yourself. Show yourself compassion. It's really hard to do hard things, and you're very brave for trying over and over again. So if you or someone you know need help, feel free to reach out.